More than 20,000 Albertans have now recovered from COVID-19, about 500 more since my last availability on Tuesday. Currently, 112 people are in hospital, with 18 cases in the ICU. As I've mentioned, this is something that we continue to watch very closely, not just the numbers, but also the health system's capacity at large, including staffing and other supports. We completed more than 14,300 tests in the last 24 hours and identified 427 new cases of COVID-19. Our provincial positivity rate yesterday was 3%. Turning to schools, there are active alerts or outbreaks in about 9% of all schools, with a total of 561 cases. There are 101 schools with an outbreak, including 27 that are on the watch list, with 5 or more cases. I also want to alert you to a couple of outbreaks that will be posted online tomorrow. An outbreak has been declared at the Edmonton General Continuing Care Centre. A total of 23 cases have been linked to this outbreak, including 19 residents. My local colleagues have assured me that all residents and patients on the affected units and all staff who have worked on these units have been tested. Outbreak protocols have been implemented to limit the spread and protect the health of everyone involved. There is also an outbreak at the Calgary Correctional Centre. To date, 24 cases are linked to this outbreak, including 20 inmates. Centre-wide testing and isolations are in place, and outbreak protocols have been implemented. It has now been 2 weeks since we announced voluntary measures within Edmonton Zone. As I mentioned on Tuesday, we saw a decline in the rate of growth in the data to the end of last week, which is a positive early sign. It is proof that collectively, by making simple changes to our everyday lives, we can reduce transmission and bend the curve. It is another reminder of our collective power. But unfortunately, this is not a cause for relaxation. In the past few days, our numbers have risen again, and while I do not have an R value, at this time, case numbers have recently been rising again in a concerning way. As a result of this rise in cases and the current and future need for hospital beds, Edmonton Zone is activating new surge capacity measures in order to support safe patient flow through hospitals in the area. With the rise in COVID-19 cases, we are seeing an increase not only in our hospitalization numbers, but also an increase in the number of frontline healthcare workers who are off due to quarantine restrictions. Because of this, AHS has made the decision to postpone non-urgent surgeries and some ambulatory care clinic visits in the Edmonton Zone. Urgent, emergent, and cancer surgeries will continue. Edmonton Zone remains committed to meeting surgical targets for the year and will reschedule surgical cases as soon as possible. AHS is taking these measures to ensure that we are able to provide care to those who most need it. While these health system impacts are primarily in Edmonton at the moment, Calgary and other parts of the province have also seen a rise in cases recently. The leading source of exposures for active cases right now is close contacts, and many of the cases that we are seeing now are the result of spread over Thanksgiving, when families gathered together. People did not mean to spread COVID, but it is a reminder that social gatherings where distancing and masking are not used consistently are a significant risk for spread. I want to be clear, I am very concerned about the rise in numbers. We are looking seriously at the spread and determining what our next steps should be. These are still early days. The virus does not discriminate, and it can have long-term and potentially devastating impacts on people's health. No one of any age can take COVID-19 lightly. You have heard me speak before about my concerns on the idea of herd immunity from natural infection, and I want to reinforce that concern again. First, those infected can have long-term risks we don't fully understand, as I have just explained. Second, our age-specific hospitalization rates from COVID have not changed significantly over time, and some younger people with COVID-19 still need hospital care. If we let the virus spread freely, even if we could limit spread just to younger groups, there would be a terrible impact on our acute care system. Finally, we are interdependent and interconnected. There is no way to successfully age segregate our population, and increased community spread puts our elders and those with chronic conditions at risk. I have also heard on another topic a lot of questions about whether we should and how we can safely celebrate Halloween this year, so I want to take a moment to talk about this as well. As a parent, I know this can be an important and fun time for every member of the family. I have always loved the fact that we open our doors to our neighbors to celebrate this holiday, and to me it embodies the community-oriented spirit that we need so much right now. As a public health physician, I also know that it can be tempting to let our guard down during those times when we are having the most fun. We have posted tips and advice online to keep this Halloween safe. I'd encourage anyone who is planning activities to review this information. However, there are a few key pointers that I'd like to flag now. First, please avoid large gatherings. This is not the year for Halloween parties. Keep your celebrations with just your household and cohort, no more. Let's keep it small and let's keep it safe. If you or your kids are feeling sick, even with mild symptoms, please stay home and please don't hand out candy. Halloween is for bringing home treats, not viruses. With respect to the question of whether or not trick-or-treating should still happen with this increase in our case numbers recently, I believe that trick-or-treating is a safe activity if done outdoors and within a household group. To keep things safe, make sure your child wears a non-medical mask, either under their Halloween mask or as a part of their costume. Keep distance from others while you're trick-or-treating. Encourage your kids to call out trick-or-treat from the sidewalk instead of ringing the bell or knocking. If you're giving out candy, wear a non-medical mask and find creative ways to hand out prepackaged candy only, for example by using tongs or a grabber. I am encouraging people to have fun and utilize other creative solutions like building a candy slide. When kids get home with their candy, make sure they wash their hands and disinfect packages before they sample their treats. This year, we will need to do things a little differently, but we can have a safe Halloween if we all take reasonable precautions.